Okay, so good afternoon, welcome, and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors meeting. Today's meeting is officially called to order. Please note for the record that Dr. Michelle Morse is representing Dr. Dave Shoxey, and Philip Wadley is representing Deputy Mayor Melanie Herzog. Oh, okay, so only Michelle Morse in a voting capacity. So next on the agenda is the adoption of the minutes for the board meeting held April 29th, 2021. Are there any questions, comments, or suggested changes? So may I have a motion?
So moved.
So let me then poll board members individually. Dr. Katz?
Yes.
Dr. Calabria?
Yes.
Thank you. Dr. Morse?
Sorry, I was slow to unmute. Yes, I'm here.
Thank you. Good afternoon. Dr. Harrison?
Yes.
Ms. Lowe?
Yes.
Mr. Nolan? Bob Nolan?
Yes.
Yes, Sally?
Yes.
Hernandez Piñero? Dr. Peñamora?
Yes.
Ms. Kawatra? Anita Kawatra?
Yes.
Thank you. And Jose Pagan, yes. So the minutes are adopted. So during the executive session, the board received and approved oral and written governing body submissions from NYCH&H Jacoby and North Central Bronx. The board received and approved governing body written submissions of the NYC Health and Hospitals Gouverneur Diagnostic and Treatment Gotham Center 2020 Performance Improvement Plan and Evaluation. The board received and approved semi-annual governing body reports written submissions from NYC Health and Hospitals Harlem. So let me move on then to standing committee appointments. According to Articles 6, Section C of the bylaws, appointments, the chair of the board shall annually appoint, with the approval of a majority of the board, members of the board to the standing committees. So I would like to propose a motion to appoint Dr. Dave Shoxey to the Equity, Diversity, and Inclusion Committee. All those in favor, please say yes.
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 Those not in favor say no. Okay, so Dr. Shoxey has been appointed to the committee, to the EDI committee. So we convene the third of 5 2021 annual public meetings for the Board of Queens on Tuesday, May 25th. The remaining meetings will convene at 6 p.m. on the dates noted below, and a determination would be made at a later date as to whether they'll be in person or virtual. The meetings are in the Bronx Tuesday, June 8th, and Brooklyn Tuesday, June 15th. Sally, Frida, and I had a very informative visit to Jacoby on May 19th. Sally, would you like to provide some feedback on that visit?
Sure. The purpose of the visit was to discuss the current status of the Plane Tree project, which had started, I guess, about a year and a half ago, but because of COVID, of course, things kind of stalled. Overall, though, there was a very positive sense that this effort to kind of get deep into the culture of Jacoby and start making changes within so that everything becomes really patient focused are well underway. And the communications that are going on, there's a main steering committee that's composed of representatives from every part of the organization. And as tasks come up, they create subcommittees to handle them. But overall, Chris was very enthusiastic about the progress that they're making, and promised that we'd meet again to get an update as they're further along.
Thank you. Yeah, it was a nice, very nice visit, and very promising approach to taking care of both staff and patients. So let me move on then to Vendec Approvals. Since we began the process approving contracts prior to Vendec Approvals, there are 6 items on today's agenda requiring Vendec approval, of which all have been approved. There are 7 items from previous board meetings pending Vendec approval. Since we last met, we have received 2 Vendec approvals. We will continue to notify the board as outstanding Vendec approvals are received. So let's move on now to the resolutions and then to President's report. Okay, so let's move on to the resolutions. So the first one is item number 2 on the agenda. Mr. Peña, Dr. Peña Mora, go ahead.
Thank you, Mr. Chairman. We are seeking to authorize the New York City Health and Hospital Corporation, the system, to sign a 6-month lease extension with Cheyenne Realty LLC, the landlord, for the use of approximately 1,600 square feet of space at 4302 Church Avenue, Borough of Brooklyn, to operate a supplemental food program for women, infants, and children, the WIC program, managed by New York City Health and Hospital Kings County Hospital Center, the facility, at a base rent of $61,437.24 per year, or $38.40 per square foot, for a total of $30,718.62 for the 6 months extension, provided the system will hold an option to extend for an additional 5 years with the rent for the 6-month extension and 5-year option, totaling $356,894.90. This was presented to the Capital Committee on May 10, 2021, and it was recommended for further discussion at the board.
Good afternoon. My name is Christine Flaherty, Senior Vice President of Office of Facilities Development. I'm here joined today by Vincent Mulvihill, our Deputy Executive Director at New York City Kings County Hospital, as well as our AVP of Real Estate, Leora John Teff. Vincent, do you want to start?
Good afternoon, Mr. Chair, members of the board, Dr. Katz. Just by way of background, Kings County has operated a WIC program at this location since 2010. We have a long history with the community. The program occupies 1,600 square feet on the ground floor. Pregnant, breastfeeding, and postpartum women, infants, and children less than 5 years of age who are determined to be at a nutritional risk are eligible for the WIC program services, which include monitoring children's growth rates, nutrition education, breastfeeding support, and high-risk counseling. Kings County also operates 2 other sites, one on Ostrom Avenue and one at the facility. There is a very strong relationship with the departments at Kings County and our WIC programs. So the lease terms, this resolution requests a 6-month extension. As you probably heard, the base rate of $38.40 a square foot, a 2% increase above the current rent. The 6-month term will commence July 1st of 2021 and end December 31st of 2021. Health and hospitals will hold a 5-year renewal option. The option term will commence January the 1st, 2022. The total square foot occupancy cost is within the fair market value range of $32 to $40 per square foot. A New York State Department of Health grant provides funding of all the WIC program operations, including the personnel and the real estate. Current funding expires September of 2021, with future funding being anticipated. The WIC program anticipates receiving a new 5-year grant. However, should the program not receive the new grant, New York State Department of Health will continue to fund the program for an additional 3 months through December of 2021.
Thank you, Vincent. And I do want to note that 1,500 patients have visited this site in the last year. Additionally, Kings County plans to further enhance the site with a new appropriately branded banner on the outside to make it a little bit more welcoming for our patients. And attached is the rent schedule that shows you. I do want to give a lot of credit to our real estate team, Leora and Jeremy and Diane, who basically made sure our funding aligned with the funding source aligned with the rent time frame, so that we could really appropriately mitigate our risks as an organization and put those risks back with the appropriate party providing the funding. So this shows you the rent schedule, the monthly and cost per square foot for each year that this is being sought. Next slide. And this just shows you a map of, the location is 4302 Church Avenue. I think we lost a graphic which shows you the line, but it's 0.8 miles away from Kings County. So the paper version had a line, and the package you might notice a little difference. But this is just to show the location relative to Kings and the catchment area, and how this really is a location that's good for a different population close to the county. Next slide. And finally, this is the resolution itself, which our Capital Chair read already into the minutes. We hope to secure an approval regarding this. Thank you. Happy to take any questions.
Any questions from board members?
I think it's remarkable that a 1,600 square foot site sees 1,500 people in a year. I mean, it's tremendous.
Yes.
Almost a person afoot.
We hope they're not all there at the same time.
No, they're not.
It's interesting that you did that calculation.
That's what engineers do.
And that
Thank-
Is
Okay,
that a dyad, mom and baby, or is it total count, head count?
I think that they
didn't
asked
hear
the
the question.
1,500 patients that we
I
see.
think that's a dyad.
Yeah,
Which means it's
Um,
double.
yeah.
okay, so let's then move on. Thank you thank you for presenting the resolution.
Thank you.
So let's move to a vote. Then Dr. Katz,
Yes.
Dr. Calamia,
Yes.
thank you. Dr. Morse,
Yes.
Dr. Harrison,
Yes.
Ms. Lowe,
Yes.
Mr. Nolan,
Yes.
Ms. Hernandez Piñero,
Yes.
Dr. Peña Mora,
Yes.
Ms. Kawatra,
Yes.
and Jose Pagan, yes. And Mr. Wadley? Philip? Okay. Okay, so the resolution passes. Thank you so much. Let's move to the next one. You again, Mr. Peña Mora?
Thank you, Mr. Chair. This is amended from the committee approval to change entity from T-Mobile Northeast LLC to T-Mobile USA Incorporated. Or T-Mobile,
Excuse
yeah.
me, Mr. Peñamore, can you
Yes.
do number 3? That's number 4.
Oh, gosh, I saw, sorry. Okay, let me
Thank
go
you.
back to number 3. Okay, authorizing the New York City Health and Hospital Corporation, the system, to execute 5 successive one-year revocable license agreements with the New York City Department of Housing Preservation and Development, HPD, for the system's continued use and occupancy of Block 7061, lots 16, 39, 40, 41, 42, 43, 44, and 45 in the Coney Island area of Brooklyn for the operation of the Ida G. Israel Community Health Center, the center managed by New York City Health and Hospital Coney Island Hospital Center, the facility at no occupancy fee payable, presented to the Capital Committee on May 10, 2021, and it was approved to be forwarded to the board.
Good afternoon, Christine Flaherty, and joined with me today virtually, I believe, is our CEO at Coney Island, Svetlana. We'll go to the next slide to give background to this resolution.
Okay, good afternoon, board members, Chair, Dr. Katz. So a little bit of
Svetlana, it's
background.
hard to hear you.
Okay, is this better? Can you?
Much better.
Good.
Good, okay. So a little bit of background. Coney Island Hospital Center has operated the Ida G. Israel Community Health Center at 2201, 2202 Neptune Avenue before Hurricane Sandy destroyed it. In July of 2015, the Board of Directors authorized a license agreement with New York City HPD for the use of Block 7061, lots 16, 39, 40, 42, 43, 44, and 45 to locate a FEMA-funded prefabricated 13,500 square feet structure. In September 2017, the Board of Directors authorized an additional 3 years. Beginning in 2015, the annual payments for the sites have been $130,000. The new license agreement is seeking 5 successive one-year terms, and this is actually a savings to the hospital because there will be no occupancy fee charged by HPD. Annually, this location provides family medicine and primary care to about 4,500 patients, dental services to 10,000 patients, and chemical dependency services to 14,500 patients. Next slide, please. This is the authorization that has already been read.
And we're happy to take any questions at this point. Thanks, Svetlana.
I have a question about the development of the site. HPD reserves the right to develop the site. Is it a site that they expect to be developing, or for the 5 years are they going to just?
Yeah, so I'll take that one, Svetlana. So we've been collaborating with HPD, and a big thank you to them to allow us this no fee for this resolution. There is a long-term affordable housing development in this area. This is the third of multiple structures. The timing of that is not fully known today. Concurrently, Svetlana is building a brand new hospital and has amazing plans at the ambulatory center as well. And so we're working closely with HPD and Coney Island Hospital to ensure ongoing services. And I don't know, Svetlana, if you want to share anything there, but we're staying in close contact. And this is timing not really exactly known because of the other construction underway nearby.
We are working closely with the community to make sure that whatever happens, there will be no interruption of services for the community. This is relatively close to our campus, and so we are confident that we will be able to provide the services that community needs, both on our campus and potentially within the area itself.
Thank you.
Bob, go ahead.
Christine, can you answer my question about the 5 successive one-year revocable consent agreements? Whose idea was it to make it an individual agreement per year? Was that ours, or was that HPD or somebody else's?
It was that's how HPD has sets up their license agreements. So it's just their standard operating procedures of 1 year at a time. So it wasn't generated by H&H, but that was the structure they required.
Thank you.
Mr. Peñamora raised his hand.
Thank you. I just want to make a comment. If we go back to the slide that Slavana presented, the details about the project, the last bullet, I would like to both congratulate Leora and also give thanks to HPD. In the past, we were paying $130,000 annually, and now there is no occupancy fee. So I think this is something that we should be very grateful for the hard work that Christine and her team, and particularly Leora, has made, and also for HPD to agree to these terms. I think this is something that we should be celebrated. We are saving $650,000 if we go all 5 years. Okay.
Thank you, Chair.
Okay, let's move to a vote then. Mitchell Katz.
Yes.
Vincent Calamia.
Yes.
Michelle Morse.
Yes.
Myla Harrison.
Yes.
Barbara Lowe.
Yes.
Robert Nolan.
Yes.
Sally Hernandez Piñero.
Yes.
Fenioski Peña Mora.
Yes.
Anita Kawatra.
Yes.
And Jose Pagan, yes. And I'm sorry, Philip Wadley.
Yes.
Thank you. Okay, so the resolution passes. Let's move to the next one. Penioski, you go next.
Yeah, now I'm going back to the one that I read before, so sorry about that. Number 4, amended from community approval to change entity from T-Mobile Northeast LLC to T-Mobile USA Incorporated. Authorizing the New York City Health and Hospital Corporation, the system, to execute a 3-month revocable license agreement with T-Mobile USA Incorporated, the licensee, to operate a mobile cellular communication system on approximately 1,600 square foot parcel of land located on the campus of the former Neponsit Health Care Center, the facility, located at 67 Rockaway Beach Boulevard, Queens, and an occupancy fee of $50,000 or $125 per square feet. This was presented to the Capital Committee on May 10th, and it was approved to be forwarded to the full board.
Good afternoon, Christine Flaherty. I'm joined today by our CEO, Helen Ortega-Laverde at Elmhurst Hospital. And the context of why Elmhurst is included in this is the cost of this site is under Elmhurst's books currently. This is a vacant property that was a former healthcare center. And some of the board members may remember in the last 6 months, we provided a briefing document to the board. Our plan is to demolish these structures and work with the Parks Department to get this site in the long term off our books. However, the summer presents opportunity with T-Mobile. And so in this, we're excited that this year T-Mobile came to us again, seeking this small agreement so that they could install an appropriate piece of equipment that allows additional coverage for the public and users of their system for cell service. And so this will help recoup some costs for health and hospitals. They'll occupy 1,600 square feet of space, which is very minor amount on this large sprawling campus where the Parks Department also coexists during the beach season with their lifeguards checking in here. And so this equipment will be there for 3 months and for an occupancy fee of $50,000. We're happy to take any questions. This is like essentially the same resolution that had been presented and approved in May of 2019.
Thank you.
And the next slide just repeats the resolution that had already been read. Any questions?
Okay, so let's have a vote on this. Mitch Katz,
Yes.
Vincent Calamia,
Yes.
Michelle Morse,
Yes.
Myla Harrison,
Yes.
Philip Wadley, Barbara Lowe,
Yes.
Robert Nolan, he said yes. Sally Hernandez Piñero,
Yes.
Penioski Peñamora,
Yes.
Anita Kawatra,
Yes.
and Jose Pagan, yes. So the resolution is approved. Thank you so much. Bye, Helen. Great to see you. Okay, Feni, I think you go next.
Thank you, Mr. Chair. Authorizing the New York City Health and Hospitals Corporation, the system, to execute a 1-year extension of its agreement with CBRE Incorporated, CBRE, for various facility management support services for an amount not to exceed $17,750,000. This was presented to the Capital Committee on May 10th, and it was approved for a discussion at the full board.
Good afternoon, Christine Flaherty. I'm joined for this resolution by our AVP of Facilities Management, Manny Size. So by way of background, in 2012, New York City Health and Hospitals and Johnson Controls made a 9-year agreement to manage our entire system's plant maintenance operations for a total cost of $362 million. This scope of work included 42 to 50 Johnson Controls staff that work supporting management, finance, and procurement services. This was professional staff that were embedded at our facilities and the establishment of a centralized office for this large-scale contract. At the time of this contract creation, there was no MWBE goal identified and a waiver was granted. In 2016, JCI sold to CBRE its facility management business. At that point in time, H&H renegotiated this contract with CBRE directly and significantly reduced the scope of work and services and brought a number of services in-house to H&H. The board was informed of this renegotiation, and the new agreement stayed within the initial term of the agreement with a much reduced cost and scope. Next slide. The reduced scope contract was set to expire March 15th, 2021. And at the height of the pandemic and as it was winding down, we entered into a short-term 3-month extension so that it would allow us time to reestablish terms with a longer-term extension and consider our options for a long-term procurement, recognizing that we needed time for that as well. Largely, we were focused as well on the best interest renewal and establishing an MWBE plan. And the current short-term extension is set to expire June 15th. The annual expenditure on the smaller scope CBRE contract is a $17.75 million expenditure. And a very large majority of this is actually the procurement of smaller scale urgent supplies and repairs across our facilities. $16 million goes towards these goods and urgent repair services. $1.75 million goes towards staffing, a small amount of staff, about 8 to 12, depending on certain periods of time. But $1.75 million covers that, which includes a few directors of engineering, some finance professionals that are assisting and facilitating the goods and urgent repairs and the expenditures to ensure the contract is within the budget, as well as some procurement professionals that are leveraging CBRE's network to source urgent supplies and products at a reduced rate that's competitive. H&H needs to competitively procure these services or insource certain elements of these services in order to ensure continuity of facility operations and regulatory compliance, but we require a 12-month contract to ensure that we have enough time to strategically plan out insourcing as well as procuring the areas of work that do not apply to something that would make sense for an insource. Now I'm going to turn it to Manny Saez, and he's going to cover the scope of services in greater detail that CBRE performs.
Thank you, Christine. Good afternoon, board members, our chair, Dr. Katz. I'll be taking you through the next series of slides, but right now we'll concentrate on the CBRE scope of services, our supplemental staff, which supports urgent and ongoing physical space needs. Payments for CBRE are pre-funded monthly, which allows immediate just-in-time payments, which require and give us the availability to order and mobilize vendors with urgent work. Urgent purchasing, 24-hour turnaround of POs to support urgent facility-based requests for physical plant needs. Repairs of systems and infrastructures. Parts and supplies to repair and replace systems and infrastructure. Regulatory urgent assessing matters and unanticipated facility life, safety, and regulatory concerns. And of course, Joint Commission related urgent supplies / repairs required during the regulatory review of environmental care. Our directors of engineering currently provided by CBRE provide everyday operation needs. They lead our departments in that front. Regulatory environment of care compliance, oversight of in-house trades, responsible for preventative maintenance programs, responsible for facility-based documentation, responsible for ongoing facility-based operations. They also provide us with expert troubleshooting of complex infrastructure issues, and of course, as mentioned before, support us during regulatory service and preparation for it. In this slide, it shows our current state. Last year, OFD began working closely with supply chain to determine insourcing this work or RFPing this work to ensure continuity of facility operations. This work was paused due to COVID, as so many things were. Majority of procurement performed by CBRE are smaller dollar amounts. We average less than $6,000. requiring same-day or next-day delivery. CBRE leverages their nationwide global network to procure urgent supplies. This was essential during COVID, where we were in the middle of needing very critical supplies. CBRE was there to help us provide that. Facilities Management has overseen and diligently reviewed the annual OTPS budget, and these urgent purchases were approved with an annual budget set by finance. The cumulative MWBE spend in the last 2.5 years is only 5.23%, but you'll see in future slides the dramatic improvement that's been made regarding that front. OFD and supply chain have been working with CBRE to increase their MWBE participation by replacing vendors with MWBE firms. CBRE provides dedicated on-site procurement, finance staff to source emergency facility items. And of course, we're in accordance with our 100-5 policy. The chart on the right represents the breakout that we have of the FTEs. The breakout that we have of the FTEs, the operational leader, the district manager, the finance person, our supply chain folks, directors of engineering, and our one elevator starter. This is the vendor's performance evaluation. We sent this out to our team, and they reported back excellent in rating CBRE. Here's a breakdown of our fiscal spend since fiscal year 17 all the way up to date for this year. You'll see on the top chart, it gives us the fiscal year, the number of POs issued, the average value of those POs, and the historical spend that we've had in combination with JCI and JCI then CBRE and H&H. And you'll see that breakout all the way from fiscal year 14. Sorry. Next slide. The bridge contract renewal justification, any best interest renewal under the system's procurement operating policy 100-05 is where the system determines that it is in the best interest to renew a contract rather than a pre-procure it. This is permissible under this operating policy. The cost benefit analysis that you'll see on this chart very clearly just represents the benefits to bridging the renewal and then the additional cost that we could potentially be facing if we switched immediately. You'll see that the competitive rates for augmentation services are good as opposed to going out. We would probably be facing somewhere in the tune of $925,000. We face a very low markup with CBRE at this point, where other firms may charge us 10 to 15%. All vendors loaded into the CBRE procurement system, which means that we have accessibility to all of the vendors, not only on their side, but on ours, and a seamless continuation of critical needed services. So we can just continue to procure as we need for emergencies and urgent needs. Here is a breakdown of the MWBE spend and threshold. There was a waiver granted to them before, but as we've been working through this extension now and hopefully the renewal, you'll see that those dollars have started to increase. I'm very proud to say that for the month of April, we exceeded 43% of MWBE usage with CBRE. We also were able to conduct, for the lack of a better term, kind of like a speed dating session with vendors and our DOE so that they can meet each other and understand the services and the repairs and supplies that they can be provided. And that was successful. So here, this is our MWBE utilization plan, where we have vendors with diverse suppliers who are pending verification. About 10% of that spend is allocated to that. A reallocation of diverse supply vendors, about 16%, is dedicated to that spend. And then identifying the additional 4% opportunities for other MWBE potentials. Here's a list of current MWBE suppliers, vendor pending certifications. You'll see that list continued on the next slide. So the best interest renewal request. To extend the contract for 1 year for an additional $1.75 million in professional services and $16 million in urgent supply/repairs. It is in the system's best interest to renew this agreement to ensure continuity of facility operations and ensure timely delivery of goods and certain urgent repairs. CBRE leverages their scale to ensure that pricing of these priced items are market competitive. The plan in the next year is to either insource the work or RFP. And my final slide, the Office of Facilities Development is requesting a 1-year bridge best interest renewal of CBRE contract for professional services valued at $1.75 million and an urgent facility goods and services valued at $16 million, total not to exceed $17.750 million, and the MWBE utilization percentage of 30%. Thank you.
We're happy to take any questions from any members of the board regarding this.
Yes, I have.
Yes.
Go ahead.
This sounds like a rich kind of discussion around what the urgent needs are. I just wonder if you can give us a little snapshot of where the highest need really is in terms of defining what service it may have fallen out, if that's a possibility today, as well as the geographics of it. Where was the need the greatest throughout our paradigm?
During COVID or just in normal operations?
Normal operations, because this is what this speaks to, right?
Yes,
Yeah.
yes. It's a range of supplies and services for a lot of our groups, especially the bigger facilities that have aging infrastructure and capital equipment. Our needs tend to be higher there than in some of the smaller sites. A lot of the flexibility that we have in being able to repair a piece of equipment and avoid, have a cost avoidance associated with it, so not have to replace it, or it can have the life last longer of a piece of equipment is, the expedited purchasing has always been a very, very important piece for us. When it comes to services, that range really spans across the 5 boroughs because we've been able to address them for services on emergencies for a broken pipe or some other infrastructure need that we'll need somebody to respond quickly on. CBRE has been able to support us there. So I'm sorry I can't give you real hard data,
Yeah.
but just in monitoring the operation over the last 4 or 5 years, it's been
Would you say that some of these services are to the edifice or the building structure, or is it internal to the hospitals or clinics?
Certainly more related around the building structures and the kind of capital, the aging infrastructure of some of our facilities.
Yeah, that's what I wanted to
Need a lot more TLC these days than they did when they were there.
Okay.
It's pipes, it's plumbing, it's HVAC systems, it's refrigerant systems, and it's really everywhere. So I don't think we have one facility that, we have our capital planning and we continue to identify the needs. And this does inform understanding if we have continuous break fixes that are happening, it will inform us. And Oscar and Manny are joined at the hip often as we plan out certain facilities. But this is really just ongoing and basically everywhere.
Okay, so Sari has a question, then Fanny, thank you.
Okay, a comment and a question. The comment is, as you think about insourcing the work we're conducting in RFP and building out on what Barbara just said, the ability to respond quickly to urgent needs is more often done, it's often done better outside of the hospital system, the infrastructure, the bureaucracy of the hospital system. And so just as you make your decision about what to do, I think it's just an important factor to consider.
Thank you.
The question is, how are you doing with what you've insourced so far? Since 2015, I guess you insourced a fair amount.
So actually, I want to take that because I want to
Okay.
give credit to Manny as a
Oh.
leader because he was a key member of the team that insourced, and that included the need to lead a team of directors of engineering, that's really where the biggest amount of insourcing occurred, was establishing a team of facility management professionals across our facilities and having them be H&H employees. And I think at this point we have I could count, I think we have 2 or 3 directors of engineering left that are not H&H employees. We also have been working, Manny's done a great job setting up a career track for our assistant directors of engineering to move into directors of engineering. And sometimes my latest losses of directors have to do with them being promoted within the facility because of their skill set. So I think that that portion of the original JCI, then CBRE contract, is a great opportunity to continue towards insourcing. I think it's the urgent, I need it yesterday to show up now for a fix. That is the part that we do have some caution on thinking about insourcing just because of the nature of the unknown and the unanticipated. But I would say that that portion of it, Manny and the whole team has done a great job.
Congratulations, Manny.
Thank you very much.
Congratulations, yeah. Fenioski?
Thank you, Mr. Chair. I just want to make a comment. Again, I would like to congratulate Christine and Manny for the great work that they have done with this procurement. I would say that if we look at from three perspectives, they really provided a very good rationale why this is best interest renewal in terms of the savings of renewing this contract instead of going and procuring this contract at this particular time. And so I really would like to thank them for their explanation and the facts that they share. I also would like to congratulate them for the work that they have done in MWBE. It shows a lot of creativity, effort, and partnership with the vendor in order to ensure that we have the best suppliers possible from a diverse pool. And I think this is something that we should emulate in a lot of other contracts that have similar legacy of MWBE waiver and contracts that have such a large amount that sometimes it makes you scratch your head on how come we do not have participation of MWBE in those contracts. So again, I would like to congratulate Manny and Christine for the work on that. And thirdly, I would like to also thank them for the deliberate approach to understand what is the best process to decide if it makes sense for the system to insource all those services or procure it again. And I think this deliberate approach will really help us to understand the facts, do the math, and take the best action and decision possible. So I would like to, again, congratulate and thank both Christine, Manny, and her and their whole organization for such thorough presentation for this contract.
Thank you. It would not have happened alone without the hard work of working closely with supply chain as well as the diversity team in that office. So thank you so much for that feedback. We appreciate it greatly.
Thank you. Any other questions from board members? Okay, so I would like to move to a vote next then. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Calamia? Dr. Morse?
Yes.
Dr. Harrison?
Yes.
Mr. Wadley?
Yes.
Ms. Lowe?
Yes.
Mr. Nolan?
Yes.
Ms. Hernandez Piñero?
Yes.
Mr. Peña Mora? Dr. Peña
Yes, yes.
Mora? Ms. Kawatra?
Yes.
Jose Pagan, yes. So the resolution passes. Thank you so much.
Thank you so much.
You get a break now, Christine and Manny and Fenioski. So I go next, number 6. Authorizing New York City Health and Hospitals Corporation, the system, to sign a one-year agreements with each of Venice Media Group LLC, Sherry Matthews Group, Matthews, Barfield Public Relations Inc., and the Esposito and Partners for the 4 firms, together the vendors, to perform assignments given by the system to purchase media placements for the promotion of COVID-19 testing and vaccination for a total amount not to exceed $25 million. And this is being presented directly to the board today. So.
Thank you, Dr. Pagan. So good to see everybody. Today I want to talk to you about our T2 media placement need moving forward for the COVID pandemic. By way of background, we need media placement as part of our test and trace core efforts to raise awareness and education in all of our communities around testing and the vaccination effort. So far, our media placement or media buys have been done through DOHMH vendors. This is a proposal here to take that effort and bring it in-house with our own vendors so that we can be quick and responsive as needed as the pandemic continues. I'll give a short example of why this is important to us. So one of the things that we've found is highly effective in our ability to control the virus is something called our hyperlocal approach, where we look at different communities and we see in the communities that there might be an outbreak or a rise in number of cases with lower testing in those communities. Last summer, we did this in communities like Sunset Park, like Soundview, and we were able to drive down the percent positivity in those communities by the same amount, exactly 2/3 in each of those efforts. We need to be nimble and deploy resources like this media resource into those communities quickly and effectively. And this proposal would allow us to do that, to continue to do that moving forward as we see outbreaks in the future. In terms of an overview of procurement for us, there was an emergency formal solicitation in September 2020 conducted by New York City Health and Hospitals. It was an MWBE only solicitation out of the Corporate Communications and Marketing Office. The premise of this was supporting awareness and education around our COVID and testing efforts. And there was negotiated rates to cost plus 7%. The final contracts were entered into with 4 MWBEs with a contract of $7.5 million. Those 4 were Venus Media Group, Sherry Matthews Group, Barfield Public Relations, and Desposito and Partners LLC. To continue the procurement to where we are now, rather than do an emergency procurement, we're leveraging the recently conducted procurement as a negotiated acquisition under OP 100-05. Under a negotiated acquisition, the system solicits only those vendors that meet its procurement criteria. Here, these 4 vendors are the only vendors that meet the criteria of scope, timeline, MWBE requirement, price, and quality. In terms of scope, the recently conducted solicitation was for the same services and populations that we need to reach currently. Timeline, having to reprocure would create a gap in our advertising efforts, and current vendors' knowledge and experience provides continuity. MWBE, these are all 4 NYC certified MWBs who are uniquely positioned to engage our target communities that we want to get through to with this effort. Price, the rates were negotiated down by 30% from the prior procurement given the larger scale of this new body of work. Quality, these vendors have all performed well during the 5 months that they've been a part of our campaign from October 2020 to February 2021, and they would be able to handle the additional work anticipated through June 30, 2022. In terms of the contract goals, expected services include things like TV and radio buys placement, including terrestrial and satellite, bus shelters, subway cars, digital monitors, taxi TV, Link NYC kiosks, and ad placement in ethnic and community media publications, in addition to ad hoc requests like the urgent needs that come up when we see an outbreak as part of our hyperlocal effort that I described in the beginning. Benefits include, we have a working relationship with T2 and these vendors. There's been strong performance and they've had innovative approaches. All are MWBE certified who are uniquely positioned to engage our communities that we want to engage through this effort. And there will be no gap in the critical messaging that we need to continue from the COVID testing and vaccine perspective. As assignments arise, each will be thoroughly evaluated and awarded to the most qualified vendor based on content, audience, and scope. So finally, our approval request is we are seeking approval to enter into contract with the existing pool of 4 MWBE vendors as follows: Venus Media Group, Sherry Matthews Group, Barfield Public Relations, Desposito and Partners, with a contract term of June 1, 2021 through June 30, 2022. The implementation and rollout would begin June 1, 2021. The not to exceed would be $25 million, and funding for the totality of this effort will come from NYC. Under an existing T2 MOU with OMB, which is effective for expenses through June 30, 2022. Thank you, and happy to answer any questions.
No questions. I have a comment.
Yes.
First, thank you, Anna. I have never seen in the decades that I've been engaged in various roles, even an advocate, the kind of work output on getting a message across. And it looks so good. It's so effective. I've had my own little flirting around with media on a smaller scale in lifetime. But this is the time to do this work. Mm-hmm. And it's very, very good work. And I don't want to see an interruption through political changes. I'm so sorry. I know I shouldn't be saying that on the board meeting, but I have no choice.
Thank you. We appreciate the sentiment.
No, I have no choice. This is life and death. Mm-hmm. It really is. Mm-hmm. We have mastered the ability to change perspectives, and we continue to do so. You know, we focus a lot, news media on who hasn't been vaccinated, but we've done tremendously well. Mm-hmm. And when I see the briefings every day, I look only for you all. Because that's where I get my substance from. And so thank you so much. And whatever we have to do to continue to support the work you do is important to us. I only concern with schools reopening and the babies. The babies are very smart. I had brunch with my school age niece, grandniece and nephew. They're very smart. They know what's happening.
That's cool. Thank you.
Thank you.
Thank you for your support, and we're eager to continue this important work.
This is life and death.
Danielski, go ahead.
Thank you. I just want to follow up on Barbara's comment, and I just want to again thank you, Dr. Long, for your amazing leadership of this program. As Barbara mentioned, it's something that we see, and it's just we feel what a difference you have made, and of course, with the leadership of Dr. Cass and everybody in Health and Hospital. I also would like to congratulate you on the way that you organized this contract. Not only you save 30% on this contract, but you also involve companies that come from the groups that have been heavily impacted by COVID. It's almost getting their own people talking to their own people. And I think this is something that we should applaud, the way that you were able to procure, save money, and at the same time, increase that connection between us and the community by having people that understand what the community have gone through and the different challenges, and being able to communicate with them the great support that they have at Health and Hospital. So I just want to commend you, and I hope that we could see contracts like this in this type of instances that have similar approach to connect the community with the people that are serving them. Thank you.
Thank you, Fenny.
Thank you, Fenny. Anita, you have a question?
Thanks, Jose. So I agree with Fenny-Oski and Barbara's comments. Thank you. But I would love to know, do we have any metrics on how, particularly like what the numbers are in terms of our success, and any metrics related to the work of these groups?
Actually, I am joined, I was remiss to say, by Julie Bolser on the phone. So I'm going to see if Julie, or actually even Anna, want to comment on some of the metrics of their performance so far.
Anna has it.
Go to the,
Come on, Anna.
you have to go to the podium. Go to the podium, please.
The question was for the initial performance of the 4 vendors. Any metrics
Yes,
you want to share?
unfortunately, I don't have the specific data in front of me. We could share, we do have it. It's super impressive. They did a fantastic job in engaging millions and millions of impressions and people with the work that we asked them to do. They were super creative in presenting to us new ideas of reaching some of these special populations that we were trying to target through a lot of digital advertising, digital engagement, live Facebook activities with social media personalities that connected and represented some of the populations we were trying to target. So they were really great to work with, and they have so many great ideas. So I'm just happy that we can direct this additional funding for advertising to them, because they really, really helped us reach those populations very specifically in a way that their expertise with communities of color could bring, you know. So we'll share the specific data.
Thanks, Anna. And Julie Bolser, if you're on the phone, if there's anything you want to add.
No, echoing everything that Anna said. These were firms that were worked with in the first round on those specialized needs that we had, and had an excellent performance with the citywide campaign. We've also had very high levels of engagement, millions of impressions. So look forward to working with these tried and true partners and continuing the good work in, as Dr. Long said, that very tailored level that we know we will need to be at this new phase of the pandemic.
I'd just like to add that the talking heads that are impressive as well is our medical leadership, you, Ted, Chosky, and Dr. Katz.
Thank you.
Thank you.
Please always sit next to the mayor.
Oh, go ahead, Sally.
Yeah, as this evolves and you actually have content, it would be wonderful to see some of the work that they're doing. Does the Department of Health do things separately. I know that Dave Chopsey is often seen, and they have the commercial with the number of doctors all saying, do we work together, or do they, do they do their own rollouts?
Yeah. So we're to answer the first part of your question. So the creative for this is actually done by is assisted by another vendor as well, and then these are the vendors that actually put the purchases out there. So I would love to bring back to the board some more examples of some of the work that we're proud of anytime. I will plan to do that. In terms of with the Department of Health, we're in lockstep at all steps in this process, which is actually why. Previous to this, the Department of Health for the last year had been going through their vendors in order to do the ad buys. So as we look at areas like if we're seeing an uptick in terms of percent positivity or lower testing or both of those things, we identify that uptick with the Department of Health. So we're in lockstep and using the data to identify where we need to go. And this is one of the tools that we have in our tool belt that enables us to actually go into those communities like Sunset Park, like Soundview. We do our part, and then the Department of Health also brings their tools as well, and that's how we approach this from our hyperlocal approach.
Thank you.
Any other questions? Okay, so I would like to call for a vote. Then Dr. Katz?
Yes.
Dr. Calamia?
Yes for me. Yes.
You, Dr. Morse?
Yes.
Dr. Harrison?
Yes.
Mr. Wadley? Philip?
Yes.
Thank you. Ms. Lowe?
Yes.
Bob Nolan? Mr. Nolan?
Yes.
Sally Hernandez Piñeiro?
Yes.
Yes. Anita Kawatra?
Yes.
Fenioski Peña Mora?
Yes.
And Jose Pagan, yes. So we approve the resolution. So next.
Thank you very much.
Thank you.
And hold on a second. Let's move on then to the President's report.
Okay. Well, the first part follows the last presentation very well. This board has been so supportive of Health and Hospitals' response in caring for sick people through COVID. And today what I want to highlight is how big a role Health and Hospital has played in driving COVID out of New York City. We're almost at 900,000 vaccinations that we've given, which I think shows how much of our role we've done. And test and trace as well, the largest test and trace effort and most successful anywhere. So I'm very proud that as the streets of New York City come back to life, that you can feel that not only did we do our job in caring for sick people, but we did our job in getting rid of COVID. While we're getting rid of things, we want to get rid of race-based medical assessments. We know that race is not a homogeneous genetic characteristic, but is a socially determined multifactorial concept and has no place in deciding the health of people. So we want to eliminate race-based calculations. We always want to treat everyone as an individual. And we've taken the steps of eliminating the use of race-based determinations for kidney disease and for vaginal birth after cesarean section. And we're looking at other issues that have been traditionally had a race-based metric and seeing how we can eliminate those. We're very proud to be with the board president, borough president Donovan Richards, and received $5.5 million. Many people pointed out that our former board member and current CEO of Elmhurst, Helen Ortega, had in her first days began to call various political leaders and request help for Elmhurst, and we're already seeing the benefit of that. There's a long external affairs update that I'm not going to attempt to read, but I want to mention the state hospital bill hasn't yet been signed, but would have us work with our partners, NISNA. We already have a very positive relationship with them for a staffing committee, And I think the bill would just extend that work. There are also requirements in terms of daily averages of nursing care services at skilled nursing facilities, and those we already meet. We had a successful financial committee meeting at the board. They were extremely complimentary, both of the fact that health and hospitals played such a huge role in healing the city through COVID. And this fits the financial update, the last item, that we've done a pretty amazing job of billing insurance. And that's what's keeping us going. We had a positive net budget variance through March of $65 million. Direct insurance-related receipts are $331 million better than the same period last year. And you remember, of course, each year we've done better than the year before. We closed April with $300 million of cash on hand. We hope to close May with $550 million. The city has transferred nearly $750 million to support T2. A major issue for us, and we're all working very hard, is to make sure that FEMA pays their bills in a timely way. So it's less a concern about whether they will pay than when they will pay, since we're talking about very large numbers. We have paid out $1.7 billion, and they have paid us $266 million. Right, so we in the city have limits on our cash flow, and so we are anxious to continue to work with them. But we are, and we believe we will be successful. So with that, I close my report, Mr. Chair.
Thank you, Dr. Katz. Any questions from board members?
I guess you pointed out the state legislation, and it's regarding both staffing for nursing and staffing for nursing homes. And I think you said that on both counts, we're in very good
Yes, different. On the acutes, the state bill requires a committee but doesn't set any ratios. On the skilled nursing bill states a ratio, but we currently meet that ratio. And I think that's consistent with the idea that nonprofit skilled nursing facilities have always put more money into staffing than some of the others, especially the public ones.
Okay, thank you.
Thanks. Dr. Merce, do you have a question?
Yes, hey there. Thanks so much for the report. I am just really encouraged and excited about the clinical algorithm changes that you all have made, and thankful that you're leading the country in some of that work. I hope that it has ripple effects and encourages other hospitals and health systems to do the same. And I was just curious to know if you're looking at, or if you're thinking about looking at, the folks, for example, for kidney function with chronic kidney disease or end-stage renal disease, if you're considering looking at patients who essentially had delayed care because of race correction, and if you're thinking about engaging them in any particular way, or doing anything around patients who did suffer harm from race correction, like in kidney function.
It's a great point. I'll raise it to we have a very active renal group, and ask them to look. It's a number of people that we could get our hands around, right? Because what we're really talking about is the people who are near a threshold, right? I mean, part of why we don't like the correction is because it could make someone seem like they don't need a renal transplant when they do need a renal transplant. So trying to figure out, who moved or didn't move. That's not. It's a manageable number. So I will ask them to look at that.
Thanks for that. Yeah, that sounds great. And the reason I mention it is we did a study on this at my former institution, and of the 2,700 Black patients in our CKD registry, we found that a third of them would have been reclassified to essentially a worse stage of kidney disease without race correction, and that about 90 of those patients would have been met the threshold to refer for kidney transplant and weren't because of race correction. So it delayed their listing on transplant. So yeah, I would, yeah, I'm just excited about it. Thank you for that, and sounds great.
Do you have a question or no?
I'm good. I have an addendum that I think I'll just leave for Dr.
Okay.
Katz. It's the Nurse Staffing Act of New York State, which is big.
Okay. Okay, so any questions or comments for Dr. Katz? Okay, so thank you so much. So committee reports to the virtual meeting setting. The committee reports were emailed to you for submission into the record. Is there any old or new business to come before this board? If there's no further business, I declare the NYC Health and Hospitals Corporation Board meeting adjourned. Thank you so much.
Thank you.
Thank you. Nice seeing you all. Thank you so much.
Bye.
Thank you.
So I'll set up a hotline that's specifically based on the school, and then